as well. Okay, so it says we're live. So hi everyone, it's Dr. Lisa Tabrizi here again with my coworker, Dr. Katrina Greer. She is a chiropractor, and we've been beginning a series on supporting different areas of your health from the angle of a chiropractic lens as well as a naturopathic lens, and we are here today to talk about healthy pregnancies. In case, Dr. Katrina, people didn't see our previous video, give a little intro and background on your area of practice and where you're located, and take it away.
Yeah, so I'm Dr. Katrina. I practice in Orleans, which is just east of Ottawa, so our capital here. And I see a bit of everything. So I run a very family wellness-based practice, but I see a whole age range from infants through childhood, different life transitions like pregnancy, all the way up to like postpartum and even seniors. So I do see men and women, but I do have a bit of a soft spot for moms and their kids. And yeah, so there's a lot of different things that come on. I like to manage a lot of issues with, the muscles and the skeletal system. A lot of people think of chiropractic and the spine and the joints, but it's really about optimizing the function of the nervous system, which is huge throughout the lifespan as we go through all these different milestones.
Absolutely. And when not more important than when you're trying to grow another human being?
Exactly. It's probably arguably the biggest transition your body will make, and one of the most amazing things that we're capable of doing. So it's important to have that support from all different types of professionals, from naturopaths to pelvic floor physios. And I'm just happy I can play my role on the team.
Yeah, absolutely. And we're going to get into some practical solutions and ideas, techniques people can utilize if they're having discomfort during their pregnancy. But I want to just kind of give a little background on some of the hormone changes that happen to kind of segue into, okay, so this is what's going on physiologically, and then there's going to be some practical tools that Dr. Katrina is going to share with you. So, and of course, Dr. Katrina, interject me, as we're going. So there's a lot of different hormonal changes. I'm sure everyone is already aware during pregnancy, and people joke about, oh, I have the baby brain and crazy mood swings, and a lot of that is attributed to the significant increase in hormones that we have during pregnancy. Now, for women, we already have estrogen and progesterone, and even for men, there's HCG and levels of estrogen in men as well. So they are produced by the sexual organs. A little bit of HCG is also produced by the pituitary gland. But what's unique about pregnancy is once an egg has been entered in the uterine lining, progesterone levels start to increase. When your follicle hatches from the ovary, it's released from this sac called the corpus luteum, and it leaves this little sac behind, which is promoting the production of progesterone. And if that is implanted in the uterine lining, the increase in progesterone combined with the implantation of that follicle or that fertilized egg leads to the development of the placenta. And the placenta ends up increasing the levels of estrogen, progesterone, and HCG in huge, significant numbers. So I'm sure a lot of you are already aware, like, what's the hormone we check for when you're looking for a pregnancy test? HCG, right? So this hormone becomes dramatically increased when there's a positive pregnancy. And it takes usually about a week after the implantation. So you typically start screening for HCG levels in the blood and in the urine about a week after a period. That's when the levels are going to start to be large enough to be detectable. But for some, it might be a little bit earlier, and some it might be a little bit later. And certainly, if you have multiple pregnancies, like twin or triplets in there, you're going to see huge increases in HCG. And it's believed that HCG may be the cause of why women experience morning sickness. Again, maybe, we're not sure. It's never been purely defined, and not every woman experiences morning sickness. Not everyone experiences it in the same degree. And so it appears that for some women, whether it's much higher or they don't tolerate that hormone properly, there could be other factors that play with why some women experience morning sickness more. So
even pregnancy, it could be different, right? So some women may in their first trimester have morning sickness with one, but then their second or third baby, not so much. So even though there's a consistent pattern in these hormonal changes and how you can detect the pregnancy, pregnancy to pregnancy is going to be completely different.
You are absolutely right.
Delivery, and therefore the plan you have to make.
Yeah. You have to always be flexible, and yeah, so stress could also be an impact on why some people experience more morning sickness than others. And there's some thought too that it depends on the level of toxicity in the body, because think of what's happening with morning sickness. You're purging, you're vomiting. So one of the beliefs as to why this happens is like kind of bring the body up different toxins. So, or theory could be that maybe this plays into a role, maybe this plays a role in actually supporting the liver is really important before pregnancy, and that's why a lot of naturopaths work so closely at supporting the health of the liver. Okay, so HCG, so we also associate with increased pregnancy and around week 11, so in that first trimester. Now, progesterone and estrogen, they're going to be increasing rapidly throughout all of the trimesters and becoming the highest around the third trimester, around week 32. Now, obviously, these two hormones are responsible for a lot of the changes happening with pregnancy. Estrogen helps to increase blood flow to the uterus, but also you're going to see changes throughout the body, right? Estrogen is increasing blood flow, and so it also is one of the key hormones responsible for increase in breast tissue, tenderness in the breast. And you see that quite early on in the trimester, and that is an increase in estrogen levels.
I'm going to say the change in breast tissue and the different hormones in the body changing the ligaments and the function as you grow a baby and your body makes room for that. That tends to be when women start to come in, when they're having that discomfort too, and their breasts are getting bigger, and there's a lot of stretch happening in their ligaments. So
and their center of gravity is changing.
Exactly, their center of gravity is completely different. Yeah.
Now, progesterone, as you were mentioning, just the ligaments start changing. So progesterone's main action is to relax muscles. It helps to prevent uterine contractions prior to labor and delivery. So we don't want the uterus to contract until it's time. Now, conversely, let's say when you're menstruating, when you're not pregnant, that drop in progesterone is dropping because there was not an implanted egg in the uterine lining. That decrease in progesterone ends up leading to why we have a menstrual period. And so that, remember, the uterus wasn't contracting, the progesterone goes down, and then your uterus is contracting, you have a period. So in pregnancy, you're keeping the progesterone elevated for 9 months to prevent that uterine contraction. And so conversely, this is relaxing muscles, and this could lead to what Dr. Katrina was just saying, where it's going to change your posture, how all your organs are sitting in the pelvic cavity. And then we have another hormone called relaxin. It's also secreted by the ovaries as well as the placenta, and it's going to help to relax all the ligaments and tendons in the pelvic floor. And this can lead to a lot of discomfort in the sacrum and pelvis. I'm sure Dr. going to talk more about this a little bit.
I feel like that's kind of happening. Like, all of this is happening subconsciously, right? Like, other than things like morning sickness you're painfully aware of. By all the hormonal shifts, you're not in tune with that. But when you start to feel different aches and pains in your body, that's when you'll really come in. So often moms will come in. I say mom because sometimes it's their second. So there's all these added strains of posture, especially if they're carrying around another little one, breastfeeding, something like that still. But one of the main things is, their head tends to go forward like this. So that kind of anterior head carriage. And that's perpetuated more by I'm just gonna stand up here, by their center of mass changing, because as that breast size grows, you go forward and you're growing belly. So you go forward like this. So you get more of this kind of pelvic tilts, you get more of that lumbar lordosis.
Yep.
The belly grows and you go forward like this. And then the shoulders come with that too. And you get kind of that pregnancy waddle, right?
Yep.
So you have all those changes happening. On top of now, your ligaments and muscles aren't able to support you as well. And there's reason for that, right? There's even rib flaring that happens. So like right in here, there's normally an angle and your ribs are opening up to make room. But that can cause all kinds of mid-back pain, neck pain, sometimes even headaches. And you might notice, just like with a woman's cycle, how symptoms tend to vary, month to month with hormonal changes. Now it's just happening in an even bigger way.
Yes,
I would say
greater timeline.
Yeah, and I would say with the head going forward, I mentioned headaches and neck pain. Those nerves that come from the neck, they go all the way down the arm. And a lot of women get like carpal tunnel syndrome. It must be something too you might see with treating with acupuncture.
Yeah.
So you have the pressure on the nerves. So I check the neck for joint restrictions, or what a chiropractor calls a subluxation in the cervical spine, to see if that median nerve that's in the lower neck, if it's impinged here, maybe there's tight muscles here, but then you have all that fluid retention as well. So you get edema in the wrist, not to mention your feet. So there's a lot of things you can do. You can get acupuncture, see a naturopath, chiropractors. Well, we can adjust the wrist itself or check the cervical spine, but even simple things like elevating your feet. So it's good to see someone as soon as possible, not just like to plan for these changes, because they're going to happen.
Like carpal tunnel, like now a lot more people are getting carpal tunnel just simply because of the amount of computer use, cell phone use. Like at large, the population is more prone to develop carpal tunnel, but then during pregnancy, this is a great increase that we see. That's why I keep kind of, did you know, have you ever heard that you can get carpal tunnel in pregnancy? Like this is like a novel you know, so at the onset of Dr. Google, they come in knowing a little bit more about these things already. But yes, we're experts.
Is carpal tunnel syndrome, right? It's a syndrome. That's what it is. It's a collection of symptoms. So there's a lot of causes, and it could be, you know, due to pregnancy. But that's one of the good things, is that some of these aches and pains go away postpartum. Other ones, if you don't prepare, things like pelvic pain, maybe pubic symphysis dysfunction, or low back pain, if you don't prepare to rehabilitate that area or your pelvic floor postpartum, those are the things that might stick around, and you might get more issues later on in life, especially with the hormonal changes that happen not only postpartum but in menopause and things like that. So the more you can do now, yes, some of the aches and pains, some doctors will say, oh, that's just caused because you're pregnant. Yes, some of it is, and it will go away, but a lot of it won't. So it's good to plan ahead.
And it's good to treat things more acutely too, because say at postpartum, the body is ready to heal. And so the more quickly we can start to treat things in the postpartum period, everything's already in an acute healing state. Things are going to reset better than, say, you come in 3 years from now and say, oh, or sometimes I got 8 years, 10 years, never lost pregnancy. It's still possible to treat, but it's much more difficult as things become so chronic and things have maybe developed scar tissue and things like that.
Well, and I like how you did that postpartum, because you're in a healing state. Because I practice corrective care with the chiropractic and I deliver adjustments to the joints, you almost have this window of opportunity, this like 6 to 8 weeks while things are still shifting. It's honestly, it's months to years before if you're going to adapt to a new normal, what your body is, right? But it's in that first 6 weeks where you're still having the hormonal changes too, that you can really, the adjustments are going to hold a little longer, and you have an opportunity to really correct what's happening in the spine. So it's great to see. If you don't see a chiropractor during your pregnancy, it's really great to see one postpartum to get adjusted, especially in the pelvic area and things like that.
And something like heartburn is another common symptom that's what many pregnant women experience, particularly moving towards the third trimester. And again, remember those hormonal changes. So we're getting progesterone is elevated, relaxing the esophageal sphincter, which means acid can move back up. Combined with you have a growing fetus, so everything in the abdomen is getting pushed up and down, and that's creating less space for the stomach. And so that can lead to heartburn as well. And I'm sure some of the postural elements too contribute to that too.
Yeah, absolutely. I'm glad you mentioned that, because heartburn can be from certain foods and definitely positional and with the growing fetus. But a lot of pregnant women, they have restriction in their mid-back right in here. So there's different exercises.
That's me. Even when I'm not pregnant.
Exactly. Well, that's what I'm kind of trying to highlight here too, is a lot of these things. Someone's like, I have heartburn, I have pain, and they're not carrying a baby at all. So while these things aren't necessarily normal, they are very common. So the mid-back pain here, not only are you having actual restrictions, which can cause kind of this burning pain that follows the ribs and could disguise itself, like you think it's heartburn, or it could be chest pain. But the nerves that actually supply the upper abdominal organs, so such as your stomach, your heart, your lungs, those nerve supplies are coming from your thoracic spine. So it's really important through adjustments, if you're going to do that, to keep that area mobile and moving, but also to do exercises that promote that thoracic rotation and extension. Because as I mentioned, we're very much going forward into that flex posture. So it's important to keep that moving. So one of the ones, I actually have a video of it on, I believe, my YouTube or my Instagram, is you're kind of like in a quadruped position and you're doing this kind of thread the needle technique where you're reaching up to the ceiling and reaching underneath, and it's just getting rotation into that area. You can lie on your back and it'll demonstrate after, and really do like open up the pec, because if you're rotating the upper body, you're going to be adding in some rotation to that thoracic spine, all those muscles that attach to your pec. your scapula, like your shoulder blade. So, you know, of course, keeping active with things like walking and keeping up your normal exercise routine is important, but there are specific other exercises that if you're not doing them might be good to add in. Still, it's good to get assessed first, but that's why things like yoga that kind of incorporate a lot of these stretches are so popular surrounding the perinatal period.
One thing I just thought of while you were speaking there, so going back to nausea and vomiting during pregnancy and the thoracic spine, I know I've experienced after a period, say I had the stomach flu, I was vomiting, to sublux a rib, and to then experience a lot of chest pain or difficulty even feeling like chest pain when you're breathing after a particularly aggressive vomiting. So that's another thing that people might experience, and you'd be able to something like that, right?
Yeah, and I think as well, it's an area that I notice a lot of stress or pain in people who are experiencing stress. And it doesn't have to be like mental stress, like your go-go, but your body's undergoing a physical stress because of all these changes. It tends to be a very common area, and that's why other people experience these symptoms too. So it's definitely good to see someone to kind of tap into that parasympathetic, which is the rest and digest, the calming part of your nervous system. So the part that controls things like immunity and reproductive health. So it goes far beyond just getting those joints moving and that stiffness out. It's about optimizing the function of the nervous system, which will help mom feel better. But the baby, when I hear moms say, I want to have a healthy pregnancy, what I'm really hearing is they want to grow a healthy baby. So while we can do everything we can to control the stress in our environment, right? Like we eat well, we try to get good sleep, we control our physical environment, the people we're surrounded with, we want love, all of those things. Your baby's environment is very much your womb, so it's the mother. So if you can create the best environment through adapting your own physiology and taking care of your health, that's the best bet that you're going to grow a healthy baby as well, and hopefully have an uncomplicated, healthy delivery.
Absolutely. I'm just trying to think whether any other, like just before you get more into some of your other practical tips, are there any other hormone comments I wanted to make? So just remembering like that increase in estrogen and progesterone, they're going to impact the thyroid gland. And so it's really important to get your thyroid assessed during the first trimester. Normally your GP, your naturopathic doctor, your nurse practitioner would be able to screen that. And if there was any abnormality, if the thyroid's not working properly, this is a concern for pregnancy. The thyroid is going to help, the metabolism is going to affect the growth of the baby. So if the thyroid's inactive or not working properly, you could see a smaller developing fetus, which is obviously not good. But this can be easily corrected with medications and whatnot. But it's again, prevention, right? We can assess the thyroid function in a lot of detail for a person who's not pregnant. And this is a really important thing that I utilize a lot in my practice. And we have access to a lot more detail with thyroid testing because OHIP sort of limits how much thyroid, like there's lots of different thyroid markers, and OHIP prefers TSH to be run. Once TSH is abnormal, then you can run the other hormones like T3 and T4 and the thyroid antibodies. Whereas because we're working with you pay the fee for the lab test, it becomes very readily accessible to people, and it's something that's relatively affordable too. So it's really good to just be able to test these things if you're having any concerns about metabolism or energy or thinking about becoming pregnant, to get into a habit of prevention, thinking about these things ahead of time.
Yeah, because the ones that are covered by your doctor, it really just, I like what you said, it just scratches the surface. They'll only test a couple of the hormones, and then if there's nothing abnormal or outside, again, that normal range, which is just based on the population, they won't dig any further. So seeing a naturopath, like it might be a small cost out of pocket, but I don't know, let's say it's $100. That's $100 well spent, because that's not just affecting you in that first trimester or second, it's going to affect how you heal postpartum and how your baby grows and develops. So, again, we're fortunate to have OHIP and everything, but sometimes it's worth, doing your own research. That's really what this is about, is just providing the education that you can get a more thorough assessment from a naturopath.
Absolutely. And one other last hormone comment I was going to make, you were alluding to or talking a little bit about stress and cortisol and things like that. So cortisol does increase naturally during pregnancy. It does increase pretty significant. And it's actually, cortisol's tricky because it's like Goldilocks. You don't want too much, you don't want too little. It needs to be just right and right for that physiologic time period. So it is necessary for fetal development. Now, if there's problems with cortisol production, like this could be associated with an increase in blood pressure. If you're sensitive to it, you might see more stretch marks, maybe more associated with, as well as insulin resistance. And insulin resistance is a real problem for many women in pregnancy, particularly because we see such an increase in advanced ages during pregnancy, and insulin resistance increases as we age. And so insulin resistance means that a very basic physiological perspective, like you have too much blood sugar, and that ends up leading to a really large sized baby, which you may think, oh, baby is good. Well, a baby is going to have a really hard time passing through pelvic outlet, so you're not. It could lead to complications in labor and delivery. It's going to be hard to deliver the baby, as well as lifelong the baby is going to be at an increased risk for obesity and all the other risk factors that are associated with obesity, right? Diabetes, blood pressure, cholesterol issues, as well as for the mom, having gestational diabetes ends up increasing your lifetime risk of developing diabetes later in life. So typically, if you have insulin resistance or you have actual overt gestational diabetes diagnosed in pregnancy, it will normalize after the baby is born. But this is important to monitor. And again, this is where I work with prevention. I regularly screen women for their insulin level, which is a type of hormone that affects their blood sugar, and we're screening their fasting glucose to evaluate how much or how little insulin resistance is going on in the body. Because if really insulin resistance happening, it's really going to get worse during pregnancy if you're not intervention. There's so many interventions that can really remedy this, but again, promoting a healthy pregnancy. There's so many, you can see so many different hormones, and there's prolactin obviously becomes elevated near the end of your pregnancy for breast milk.
I'm getting some feedback when you're speaking. I don't know if it's my microphone on my computer.
Sorry, yeah, it says my speaker is not working.
I'm getting some feedback when you're speaking. I can hear you now. It's good. It's just kind of on and off, so I didn't know if maybe something wasn't connected properly.
I wonder, I'm just going to shut my window over here because someone is cutting their grass. Just a second.
Okay.
Feel free to entertain our audience with any comments you have.
Okay. Yeah, so Lisa was talking about insulin resistance, and that's why it's important to get kind of pre-screened even ahead of time, right? Because if you have other underlying conditions like diabetes, like PCOS, like ovarian syndrome, that is very common in the population, especially if you have other autoimmune conditions, thyroid issues. If you know that ahead of time, even before you get pregnant, you can get your insulin levels checked. And again, often, your medical doctor might check glucose, but your insulin resistance can be really important. And other conditions, I was just mentioning like PCOS and things, can actually affect your fertility. So it's good to know these things ahead of time.
Absolutely. Can you hear me?
Yeah, I can hear you.
Okay, phew. So I kind of covered the main basis I want to mention about hormones. I mean, that we could have a whole separate webinar on hormones. It's so complicated. But Dr. Katrina, you had some other items you want to share with our audience.
Yeah, so I mentioned the postural things that people come in with, like the discomforts and the symptoms. Basically, when you're influencing the body and the nervous system, you're influencing the environment that the little one's growing in. Other tools that some chiropractors might use are taping as well. So there's kin tape or KT tape. I don't know if you guys have seen pictures or things before, but they'll actually tape underneath the belly and maybe wrap a piece into the low back. It's just shifting where that belly's sitting, because a lot of women, they'll experience pain in their SI joints, so your sacroiliac joints.
Does that help to prevent diastasis recti at all, or no?
The taping, not so much. The taping more is to change the center of mass of the growing baby, because what happens is you get a lot of stress right here. Mm-hmm. Those two kind of spots, and even again, people who sit a lot can have that kind of discomfort too. It's because of the changing pelvis, that increased lordosis in the lumbar spine. So the taping can help mitigate some of the pain here. And also, when you have the growing belly, you have the round ligament in the front. It's a ligament that attaches to the uterus, And even taping in those areas can help. I often prescribe women to do some self-massage. So when they come in, I'll show them kind of how to landmark that round ligament. That's usually something you feel more in the second or third trimester as the uterus grows. Yeah, so taping can be really good for that. Or a belt that sometimes I'll recommend is called the Sorolla belt. And that's when someone has a lot of mobility. Sometimes it's their second pregnancy, so they know they had sacroiliac joint dysfunction or instability. So they'll want kind of that support. So basically, it's this belt that wraps around just like this. So we can do a lot of strengthening exercises, core work, breathing. We talked about breathing in our stress resiliency talk, or stress adaptation, not just in terms of managing that parasympathetic, but in really strengthening that core. So I would say for diastasis recti, I'll talk about a little bit. Any women who's
pause for a second. We didn't really explain, just FYI for anyone not sure what we're talking about. If anyone has ever experienced or seen a woman who like their abs separate during pregnancy, right, because of the growing fetus, and depending on the strength or weakness of the abdominal wall, those muscles can separate, and there can be quite a bit of separation postpartum.
Yeah, so that's good. Sometimes if you get kind of over, you're like, oh yeah, people know what that is. But yeah, so your rectus abdominis, it's like your 8-pack, and right in the center here, right down the middle, it's called your linea alba. And it's kind of like it's stretchy tissue, it's like a tendinous tissue, but because of the hormonal changes in the growing fetus, it tends to separate or stretch. Some people will be like, oh, do I have a diastasis? Is it tearing? It's not torn, but it does stretch quite a bit. So if you can do breathing during your pregnancy, what you're going to do is when you breathe in, you're going to take a deep belly breath, but when you breathe out, you're going to focus more on cinching in towards the midline. So it's not a breathing out and in, like you're not trying to suck everything in, you're not going to be able to, but when you breathe out, you're going to put your hands on the midline and really focus on tightening in towards the midline, kind of like you're wearing like a corset. So that's usually the baseline I start with any woman. And again, depending on where you are with your pregnancy, it's going to be difficult to really feel that and recruit it. It might just feel like hollow or you don't know if you're doing it. But if you practice doing that, as well as, you know, lifting your pelvic floor, things like that, when we evaluate you postpartum, because it's important to have an assessment then, you may have, you know, adapted better to all the changes. So basically, I would put your mind into your muscle. When you're pregnant, it's a very important time to listen to your body. So if you're being physically active, it's definitely good to remain active. If you do certain higher risk activities, like, I don't know, if you're doing rock climbing, or if you like to bike, like in a triathlon or something like that, maybe things that you have a risk of falling, or if it's like nice today, but if it's winter outside, there's things you want to avoid. But generally, I would say maintain your physical activity level. And again, if you're unsure, you can see your doctor first, but also make sure you're seeing a trainer or a course instructor who has experience working with pregnancy. You know, some moms do things like CrossFit, and there's a lot of moves you're not going to be doing, but maybe you can modify certain activities by using bands instead. You might not be doing like, you know, the different snatches and things overhead, but you can continue to work those muscle groups because it's important to remain active during pregnancy.
And that helps to increase the blood flow to the fetus as well, and it's going to improve oxygen delivery to not only your own brain, but also to the developing brain in the baby.
Exactly. And you mentioned like with cortisol, it's a hormone that there's kind of just right. So when we talk about that rest and digest, you don't want to be just stuck in that relaxed state. You want to kind of find that medium and balance out those two parts of your nervous system. So exercise is going to help with that as well. So that's a big part of exercise. Again, if you have specific questions, I suggest you get assessed and see someone. That's more something you can talk about, you know, in person. But yeah, but basically there's so many options of what you can do. But I would say breathing and any kind of like light activity, walking, band work, things like that. I mentioned
band work we should be thinking about.
Pardon me?
Is there any specific band work we should be thinking about?
Yeah, so because your head's going forward and you have that weight and this, you really want to be strengthening that mid-back. So if I'll just sit on the table here. So, and if you don't have a band, you can use like a tea towel, you know, some sort of towel. I call them like the Y's, T's, and I's, or W's. There's different ones. So one is you can just hold it out in front of you, and you're just going to stretch to the side like this. And what you're really doing when you do that is you're trying to pinch in between your shoulder blades. So you can kind of
shoulder height.
Yeah, you're trying to retract like that, like this.
Yep.
So you'll notice it's a really good postural exercise in general. But there's pulling a band like this. There's bringing it overhead, and you're just going to come down to 90 degrees with the band behind your head. So things like this.
Okay.
And then if you're standing, there's different ones where you're simply bringing it out to the side. So it's almost like you're kind of flying.
I like that one.
Well, and all of these too, especially like this one, if you're lying on your stomach, you can simply be lifting your shoulders off the ground as well. So see, anything that's going to strengthen the mid-back. There's different postures you can get into to stretch that area as well. So I come up here. You guys may have seen like with yoga, like different child's poses. And that thoracic rotation I was talking about is really going to reach under and then reach up towards the ceiling. So I would definitely say strengthening the mid-back and leaving that area mobile. The reason I keep referring to the on your all fours position is because at a certain point during your pregnancy, you're not going to be comfortable. It's not going to be advisable to be lying on your back. But in that all fours position, similar to a crawl, which is great because, you know, when you have your toddler, you're going to be getting down on the floor playing with them. It's just a good position that you can do that, and the weight of your belly is hanging, so you're taking a lot of that stress off. With the neck, kind of like the chin tuck where you're retracting straight back. Again, that's kind of an exercise I give all my patients. And with this, I notice we looked at these last time, you can put the balls in different areas, but one area moms get a lot of tightness too is in their buttocks in that piriformis, that piriformis muscle. So that's more from the exercise standpoint. So you can see a personal trainer for that. You can see a pelvic floor physio. But kind of the bread and butter of what I do with women is called the Webster technique. So it's a specific adjustment protocol that chiropractors do. And you have to do training in it through the International Chiropractic Pediatric Association. So the international
training. It's like not just in your school, it's further training.
No, like you might touch on it because all chiropractors are trained to adjust the sacrum. But it's a specific protocol where you're checking the leg length and you're bringing the heel to the buttocks to assess resistance in one leg. And that points to which side of the sacrum is subluxated or misaligned. And the reason that's important is we mentioned the sacroiliac joint. A lot of women have issues there. But there's a lot of other reasons too. So that piriformis muscle that's blamed a lot for sciatica or for pain in the buttocks or into the leg. A lot of women, they're like, oh, my sciatica acts up every time I'm pregnant if they've had multiple pregnancies. But it's still not normal, and it's something that we can do a lot to address. So other than, you know, stretching out your glutes or you using a ball in there, that muscle actually attaches from the front of your sacrum to your lower leg right here. So it's one of the muscles that's responsible for kind of externally rotating and opening up your hips. There's different stretches, but when you adjust the sacrum, you're influencing the position of that piriformis muscle. And as you mentioned, there's a lot of muscle relaxation and different things that are happening. So what I often see is you'll have one side that's really, really tight, but it's because that piriformis muscle is overworked because the other one is lax. It's not doing its job.
That Goldilocks rule again, not it's one's over, one's too much, one's not enough.
Exactly. So sometimes the problem in terms of where you need your sacrum adjusted isn't where you feel the pain, which is hard sometimes for people to understand. They're like, why are you pushing over here? But often in pregnancy, it's secondary, and your ability to adapt to the different muscular changes is only going to be so much. So you have to be patient with yourself, but it's great to have your sacrum assessed, the piriformis. Another ligament that's part of this protocol is called your sacrotuberous. So it goes from your sacrum to the tuberosity, kind of like your sit bone, the ischial tuberosity, so it's part of your pelvis. So that ligament that runs here will put some tension under because it has an attachment to that, and it's a big part of that parasympathetic nervous system. So even in infants, that's one of the contacts I'll take in a baby to kind of calm them down if they have colic or they're inconsolable in other ways. I mentioned the round ligament. So again, that's in the front. You can't see it here, but that's one that's going to change a lot with the uterus.
Maybe can you hold up the skeleton and just show even like where the pubic bone is? Because a lot of women get pubic bone pain, and just maybe point to where that is. And so that relaxin muscle hormone I was talking about earlier, it's helping the pelvic floor to relax. And so those two bones that look like they're attached together, they start to separate because they're relaxing. It's like helping those wings that you see on Katrina's pelvis separate to accommodate that breathing.
Pelvis, just judging by the angle.
Yeah, it's a little, it's a little triangular.
You'll actually see that this is a little more curved, and there's more room. So the other reason, so kind of the main reasons, I touched on the muscles and ligaments. The reason you do the Webster technique, there's 3 causes of dystocia, which is difficulty in labor, in Williams' Book of Obstetrics. So even like your gyno, your OB has learned about these causes, and they relate to power, the passage, and the passenger. So power relates to the innervation to the uterus itself. So you mentioned like going into labor, the second stage, you really want the uterus to have that increased nerve intervention and good innervation between the lumbar spine to the uterus. It's a hollow muscular organ, and in order for that uterus to contract, it needs good nerve supply. So chiropractors are trained to adjust the spine and increase that nerve communication to the uterus, right? So especially in initiating labor, there's the hormonal changes, but the nervous system is really what's kicking all of that off. So you want the uterus to be functioning well, so that's one reason. The other is the passageway. So your pelvis, where the baby's going to pass through, is largely influenced the size and diameter of it by the position of the sacrum. So you mentioned even people having big babies and things, or maybe they've been told that they're high risk. They're nervous that they're going to have a C-section or be induced because of the size of their baby. Now, in my opinion, you're not going to go into delivery, whether it's 40 weeks, 9 months, 10 months. You're not going to enter into your body's ready. So I'm more a fan of like the natural approaches of getting adjusted, getting acupuncture to induce it. But if you can help the sacrum be in the best position, or the pelvis, you're going to hopefully have less complications when you're trying to deliver. So you have good nerve supply to the uterus, you have a good passageway, and then when you're influencing the different ligaments that attach to both the sacrum and to the uterus, it helps reduce what's called inter-utero constraints. So I like to explain this as your baby is in the uterus. Think of it as it's kind of wrapped in a really tight blanket. And when we do adjustments, it releases that tension. So your baby has more room to resume an optimal position for delivery. So sometimes we see moms whose baby are in breech position, whether it's their butt first, their feet, they've had an ultrasound. And as chiropractors, we're not doing anything to physically turn a breech baby, but we restore the position of the sacrum, the uterus relaxes and all those ligaments, and the baby does what it was meant to do anyway. So the baby can resume.
And you do acupuncture to turn a breech baby. There's actually a really cool acupuncture point on your pinky toe that we needle or do moxibustion on. And it can help. It can't guarantee a baby to change because, like you said, there's other factors at play too. But it has. I've seen it work in my practice, so it's pretty cool.
The acupuncturist I work with does moxibustion as well, and sometimes I'll have chiropractic patients who come in, because they're having pain or discomfort, and they're like, "Oh yeah, I'm scheduled for my induction." I'm like, "You should see Hannah, the acupuncturist I work with." So again, I find that they complement each other really well, and sometimes I have women come in 38 weeks in their breech, and I'm like, all right, we're going to see you every day. I refer them to the Spinning Babies website, and they're doing all these like inversion positions to try to, turn the baby.
There's acupuncture for just like labor induction as well. Like even if you're not necessarily past due dates, but just like help strengthen and tone the uterus so that it's going to be ready to go.
But I guess the main thing here is we're both kind of saying you can wait until that point, 30 weeks.
Yep.
So you can start, if you're planning, kind of make naturopathy, acupuncture, chiropractic part of your birth plan when you're growing the baby. And everything's just going to happen more optimally. you'll have that education and you'll feel empowered to make better decisions. Because ultimately, a lot of these things are your choice, but a lot of women don't know the options out there. So,
and again, it's an opportunity to even like have another set of eyes. Like sometimes people's doctors don't screen their thyroid in the first trimester, and that should be should happen, right? So that's where sometimes having an extra pair of eyes on your care can really help make sure things don't slip through the cracks. You know, or if you're more at risk for developing insulin resistance or gestational diabetes, that we can work on that prevention, right?
Yeah, and then even once you have like a team, you can follow up postpartum, whether it's pelvic floor physio, getting your thyroid checked again, or getting an assessment so we can prescribe proper exercises. Again, there's a lot on my page. I'm an ambassador for a program called GrowCo. It's a postpartum rehabilitation, but a lot of the education and exercises apply during pregnancy as well. So we can kind of point you in the right direction. The earlier you come in, and I don't know, in my office, we welcome, if you have other kids as well, you can bring them along. So especially with Zoom nowadays, trying to remove those barriers or limitations so you can get the care that you need.
Yeah, so if people want to find out more, Dr. Katrina, maybe give them a lowdown on your website and social media handles so that they can track and follow you and check out some of these awesome videos, because she's got a really great social media platform and YouTube page filled with lots of resources.
Yeah, so if you're on Instagram, it's at Dr. Katrina Greer, so dr.Katrina Greer. So same as my name there on Facebook. In my bio on Instagram, I have the link to my YouTube, or you can just search Dr. Katrina Greer DC, Doctor of Chiropractic, on YouTube. You should be able to find it. And then my Facebook page as well. The website for my clinic is oaktreehealth.ca. So Oak Tree Health, kind of like how it sounds. And there you can read a lot more about chiropractic for pregnancy, for pediatrics. We have a lot of information about acupuncture, fertility, kind of all kinds of things. We have our own YouTube for that as well. So the best way is almost just to send me a message somehow, and I'll point you in the direction of the right resource, or maybe even someone in your area. If you're not in the Ottawa area, I might know someone in the GTA as well.
Yeah, and vice versa. And so just in case, if you're not familiar with my contact info, you can check me out on my webpage, drlisatnd.com. Obviously, many of you are seeing this on the Simply Healthy page, but for people maybe seeing this on Katrina's platform, feel free to join our Facebook group, Simply Healthy, Simply Strong Community Group. We just use this as a group to share different health tips and ways to stay inspired and motivated to keep healthy and well, to prevent concerns developing. And it's just an opportunity for us all to share with one another what we do to stay healthy. And yeah, you can check me out on Facebook and Instagram, Dr. Lisa T. ND. Yeah, thanks so much for tuning in. And I'm sure Dr. Katrina and I will be back. It sounds like we need to do a follow-up of what happens in the postpartum.
Maybe digestion you were talking about. Yeah. And all these things just intertwine so much. So
thanks so much, Dr. Katrina, and thanks to all of you for tuning in. We'll see you next time. Stay healthy and strong.
Bye, guys.